As many as 40 layoffs were announced last week at North Bay's hospital. Today, the union is criticizing hospital leadership and the Ford government for playing down the potential impact to patient services. CTV's Eric Taschner reports.
We are not going to take these cuts laying down.
Staff morale is very low at the North Bay Regional Health Center after devastating cutbacks were announced last week.
The staff are scared, furious, disheartened, disgusted, and they're saying, yeah, I'm probably just going to leave and go on to those jobs outside of healthcare.
The job cuts are a major setback, the union says. 40 full-time and part-time positions will be eliminated.
We had just had a meeting 6 weeks prior to this where the employer is required to disclose to the union if there's going to be any cuts, and if there are going to be cuts, they need to work with us from the beginning stages of planning on minimizing the number of cuts. They never told that it was going to happen.
Affected positions include nurses, PSWs, clerical staff, a pharmacy technician, and a patient food service worker. However, the hospital says actual layoffs could be much lower when retirement and attrition are factored in, as well as the fact 14 new roles are being created.
And we're not going to let this issue go. We're going to pursue this because we're afraid this 40 is going to be another 60 and then another 100, and there'll be downsizing of beds.
The hospital is also realigning the number of physician leadership roles starting January 1st. This is a reduction of 20%, but with no change in doctor numbers, as it looks to find $5.6 million in savings. Nipissing MPP Vic Fideli says these job cuts won't affect patient care, writing, "For the North Bay Regional Health Center, annual funding has grown by $49.3 million since 2020, representing a nearly 20% increase. The union disagrees.
They're out of touch with reality and don't work on the front lines. They don't have to look in their patient's eyes and say, I won't be back for 15 minutes. I have to go take care of another patient. We're short again today.
CUPE plans to hold a town hall meeting in December, along with rallies calling for changes within the healthcare system. Eric Taschner, CTV News, North Bay.